I'm Sherry Wooten. Our presentation is on reactive attachment disorder. I'm going to go over in the presentation what reactive attachment disorder is, what causes it, and its prevalence. Other presenters are Malia and Marisol. Reactive attachment disorder is a condition that develops in early childhood caused by a lack of nurture and maltreatment. This is usually by one or both caregivers, and it's in a highly traumatic or stressful environment that this disorder develops from. So, children can develop reactive attachment disorder under stressful conditions, such as being brought up in the foster care system, in the adoption care system, when one or both parents are either providing a maladaptive or maltreated environment, or when they simply are neglectful socially, physically, emotionally to the child. Therefore, these children struggle with accepting or providing emotional and physical closeness. So this often looks like a child becoming violent towards themselves, engaging in self-injurious behavior, or being violent towards others when someone tries to console them or hold them or hug them, any kind of physical or emotional support. So children who have reactive attachment disorder are almost always in a state of fight or flight, even when there aren't any potential threats to their safety or well-being. Prevalence. So prevalence is actually difficult to obtain for reactive attachment disorder, but it's believed that the prevalence rate is between 1 to 2%. Gender is actually not believed to be a risk factor amongst children for developing reactive attachment disorder, but in comparison to non-minority children, African American and multiracial children are actually appear to having higher rates of reactive attachment disorder due to reported stressful environments more common for African American children and multiracial children.
Hi, my name is Malia Wiseman, and I will be talking briefly about reactive attachment disorder, also known as RAD. This condition affects children who've experienced early trauma or neglect, and it can be defined by its specific behavioral signs. First, children with RAD have impaired social reciprocity. This means that they struggle to form emotional connections with others, especially their caregivers. They may seem withdrawn or uninterested in social interactions. Reduced emotional expression is another key trait. They often appear emotionally distant or emotionally disengaged in social scenarios. These children also have difficulty trusting others due to their early attachment trauma, which prevents them from building close relationships with the peers around them. Their behavior can be unpredictable and even sometimes unfriendly. And most importantly, they'll fail to seek comfort when they're upset, which is unlike most children. Clinicians will look for these behavioral patterns along with a history of neglect to diagnose RAD. Now, I will be discussing how reactive attachment disorder, also known as RAD, can significantly impact a child's communication skills. First, children with RAD often have limited verbal expression, meaning that they struggle to communicate their needs and to communicate their emotions clearly. And sometimes they may speak minimally or in ways that truly aren't expressing how they feel. Their communication can also be inconsistent, meaning that one moment they might seem calm and the next they can become verbally confrontational or emotionally unstable. RAD also makes it hard to develop connections, which affects their ability to engage in back and forth conversations. And this lack of reciprocal communication practice can make it difficult for them to form friendships or to collaborate well with others. Impaired social interaction is another key issue. They may avoid things like eye contact, facial expressions, and they may struggle with nonverbal cues like body language. Additionally, these children face challenges with emotional sharing. They might not express typical emotions like happiness or sadness, and it makes it hard for others to understand their emotional state. Lastly, they often have difficulty seeking comfort or help, meaning that they may not ask for assistance when they're upset or when they need help, and they might reject comforting gestures from others. These communication difficulties stem from early neglect or inconsistent caregiving that in turn disrupt their ability to develop normal social and communication abilities.
Hello everyone, my name is Marisol Lugo and I will be discussing in further detail about the impacts RAD has on behavior. Now, as we've gone through the previous slides, we've learned that RAD is a complex mental health condition that can have profound effects on a child's ability to form emotional attachments with their caregivers. Now, this could lead to a range of both emotional and behavioral challenges. A few significant behaviors to look out for, or you could say red flags, would be a lack of responsiveness, avoidance of eye contact and physical touch, expressions of fear, sadness, inhibited behaviors such as withdrawing, and disinhibited behaviors. Now, children with RAD will often demonstrate disobedient, defiant, and argumentative behavior, and this is often a result of their deep-seated fear of that intimacy and their challenges with trusting others due to the trauma they have experienced throughout their childhood. Examples of this could be throwing tantrums, refusing to obey rules, disruptively seeking attention, being argumentative with caregivers, and showing a lack of remorse or guilt. These are just to name a few. Now, it's important to note that because of the emotional challenges these children face, RAD can also elevate the risk of anxiety and depression, hyperactivity, and it could also reduce frustration tolerance. This is why it's so important to identify these signs and symptoms so that we can provide timely intervention and that we can provide the support that they need so that we can ultimately help improve the prognosis and avoid long-term effects on development, which can be pretty severe. Now, when it comes to behavioral recommendations for SLPs, treating reactive attachment disorder will involve a comprehensive approach that includes parent education and trauma-focused therapy. Like I stated in the previous slide, early identification is crucial to implementing effective strategies that support healthy emotional development. The sooner we can establish or identify those signs and symptoms, the better support we can provide for the child. Now, SOPs can be very helpful in setting those long-term and short-term goals for behavior management training. This could be through the use of positive reinforcement, so establishing a system of appropriate rewards and punishments to facilitate communication and social interactions. An SOP can also help create a safe and predictable environment and can help the child feel secure and understand expectations. An SLP can also help reduce the occurrence of unwanted behaviors, and then we can also help promote that positive and those healthy interactions between the child and the caregiver, and help inform caregivers on these strategies and how to reinforce those skills beyond therapy sessions. Now, it's important to note that because these individuals really struggle with those emotional connections and trusting others, that as an SLP that we are very patient, very flexible, and very adaptable for these individuals.